thank you, Minister, for your statement. It was disappointing to have received it at such short notice in advance of your statement today. And I note that you were only referring to the last 2 years of special measures regime, when we all know that this is a health board which has been struggling for almost 10 years now, having first gone into special measures back in June 2015. So it is a little disappointing that we're still having these regular updates on failings at the Betsi Cadwaladr University Health Board almost 10 years on, and that there has been insufficient progress on the ground in terms of the services that people are receiving. And I want to thank all of those NHS staff who are working hard in the system, trying to deliver the best quality care that they can. But the reality is that I'm afraid to say that all too frequently patients in my constituency and in other places across North Wales feel let down by this health board and the services that they have been receiving. You made reference to progress on 2-year-plus waits. You didn't mention the 3-year-plus waits that people are suffering in the Betsi Cadwaladr Health Board. 91% of people who wait for more than 3 years for their treatment in Wales are in the Betsi Cadwaladr University Health Board area. That is a shameful statistic. And we know that people typically are still waiting more than 2 years if they're referred today for ophthalmology treatment, dermatology treatment, orthopaedic treatment, and we've got people waiting up to 5 years, young people, children waiting up to 5 years for neurodivergent assessments. These are young people who need those assessments in order to get the proper support that they need in their education. It simply isn't good enough. You talked about improvements in emergency departments having been de-escalated. The reality is that the performance of the emergency departments in our hospitals in North Wales is the worst in the whole of Wales. Just 45% of people are in and out of the emergency departments, the main emergency departments in North Wales, within the 4-hour target. And we have the worst performance against the 12-hour target as well. I'm afraid it smacks of complacency, your response, when 1 in 4 people are not being seen and discharged within that 12-hour target. It isn't good enough. And we've had lots of promises of jam tomorrow. You've promised us just now that, more than half of the 2-year waits will be eliminated by the end of March. Well, I look forward to seeing you at the end of March in order to compare those figures, because I find it difficult to believe that they will be achieved. And we know also that you've promised jam tomorrow a number of years back when you said that you would invest in a brand new hospital in the Rhyl area to take pressure off the hospital down the road in Bodlewyddan. Over 12 years ago now, that was a promise which was made to the people of North Wales by the then Secretary for Health, Mark Drakeford, who went on to become First Minister, still didn't deliver on those promises. Always made, by the way, before an election, and then never actually delivered. I suspect we'll get more of the same today, with more hopes being built up about the delivery of that project. We were also told about a brand new project in terms of a mental health unit. Back in 2018, we were told that the Ablet unit would be completely demolished or remodelled and would have a brand new mental health unit for inpatients with 60 beds on the Glenclwyd Hospital site. Where is it? We've seen absolutely nothing. Completely nothing. So you keep promising these things in order to improve services, not delivering, which then doesn't improve services. And in fact, if you look at this whole 10-year period, from when it first went into special measures in June 2015, the performance on almost every single measure is worse now than it was 10 years ago. Worse now than it was 10 years ago. And this is in spite of so-called intervention by the Welsh Government. Well, I'm afraid your intervention is not working. It is not working. Things are getting no better in terms of patient experiences, and they are what really, really matters. And what is also shameful is that we've had failing executives at the Health Board who have left their jobs without being dismissed. People find that absolutely galling, that we've had these years of failure, but not one head has rolled as a result of those failures. People have been able to leave either with compromise agreements or on their own terms. It is, frankly, disgusting. You made reference to governance and leadership, and of course, I want to work as closely as I can with the board, with the chair, and with the executive team to deliver the improvements that we need to see, but we're not actually seeing them. Prevention of future death reports. You seem complacent again. 11 since the start of last year. 11 since the start of last year. That's the highest in Wales of any health board. Still disproportionately higher than the population of North Wales when compared to the populations of other health boards. I'm afraid this complacency isn't good enough. We need to see real change, and I want to see a clear timetable from you as a government with a clear set of actions that you will take as a government that we can measure you against. Because what's been published to date by the Health Board and by the Welsh Government isn't giving us any confidence that things are going to get significantly better.